Main causes of delayed menstruation. Small fluctuations in the menstrual cycle are normal, but if the delays have become regular, become painful, or do not exist, you should immediately consult a doctor. Pregnancy is not always the reason for delayed menstruation. Very often, irregular periods are an indicator of health problems. Many reasons can lead to menstrual irregularities. Is it possible to delay without pregnancy? The ovaries release an egg during ovulation, approximately every 28 days. If the sperm does not fertilize the egg, menstruation begins in about 14 days. While the delay is one of the first signs of pregnancy, there are many other reasons why it can happen. If your period is missing for 3 months in a row, it is called amenorrhea. This condition affects 3 to 4% of women worldwide. Amenorrhea usually occurs when the ovaries stop producing enough of the female hormone estrogen. A number of factors can cause this hormonal deficiency. Before we go on, like this video, smash the subscribe button, and click the notification bell to get new video updates. Number 1. Weight changes. Gaining or losing significant amounts of weight can lead to hormonal imbalances. Very often, this leads to a delay, but over time, the menstrual cycle resumes. Number 2. Stress. Prolonged or intense stress can affect the part of the brain that controls reproductive hormones. This can reverse ovulation and menstruation. Once the cause of the stress disappears or the woman learns to deal with the stress, the cycle will resume. Number 3. Physical overstrain. Excessive exercise can cause delay, especially in thin girls with very low body fat. Lack of menses due to physical strain is called exercise-related amenorrhea. Number 4. Too high prolactin levels. Prolactin is a hormone that the body normally produces during breastfeeding. It can stop menstruation and is the reason why most breastfeeding women do not have their period. If you are not breastfeeding, milk discharge from your nipples may indicate that your body produces excessive amounts of prolactin. In this case, you must consult a doctor who will prescribe the appropriate treatment. Number 5. Thyroid problems. The thyroid gland is a gland that produces hormones that control the body's metabolism. Hypothyroidism, or an underactive thyroid, is when the thyroid gland does not produce enough of these hormones. In contrast, hyperthyroidism, or an overactive thyroid gland, results in too high thyroid hormones in the body. Both conditions can affect the frequency of your period. Other signs to look out for: fatigue, hair loss, unexplained weight gain or weight loss, always hot or cold. Doctors usually diagnose thyroid problems with a simple blood test. Number 6. Polycystic ovary syndrome, PCOS. Women with PCOS experience a hormonal imbalance that can affect overall health and appearance and cause ovarian cysts to form. Up to 10% of childbearing age women have PCOS, which is often accompanied by ovarian enlargement. Signs of PCOS also include irregular or absent menstruation, too little, too much, or unpredictable bleeding during your period, skin problems, acne or dark spots, being overweight or obese, thinning hair, sleep apnea, problems with conceiving a child. Number 7. Eating disorders. Eating disorders, especially anorexia, can lead to missing menstruation. This happens when there is not enough fat in the body to ovulate. Number 8. Perimenopause. Menopause occurs when menstruation is absent for at least 12 months. The average age for women entering menopause is 52. However, the transition to menopause, known as perimenopause, can cause symptoms at a younger age. Perimenopausal symptoms include irregular menstruation, sleep problems, mood swings or irritability, vaginal dryness, decreased libido. Can pregnancy tests be trusted? Home pregnancy tests can sometimes give a false negative result. The accuracy of a home pregnancy test varies depending on how and when it was taken. Here are some reasons why a test can give a false negative result. The test was done too early. Home pregnancy tests determine the presence of human chorionic gonadotropin, HCG, in the urine. Although some tests can detect HCG from the first day of delay, it is better not to do the test so early for the most accurate result. Low hormone levels. Tests are generally more accurate in the morning because the urine is less diluted, which makes HCG easier to detect. Don't forget to give this video a like if you enjoyed it. Leave a comment below letting us know what you thought, and make sure you subscribe to Dima Say What.